Just to review, we've talked about long COVID before, but just knowing that it goes under different names in the medical world, chronic COVID, post-COVID conditions. And we all know there's like 200 plus symptoms. So lots of different symptoms and conditions, the most common being like brain fog, as well as some chronic cough. And it's really things that people experience over 4 weeks after the initial COVID infection. And really, it's like 3 months or longer after the initial COVID infection that we really become more certain that it's long COVID. And oftentimes, the persistent symptoms that are continuing after the initial COVID infection. So, not necessarily symptoms when you have your acute COVID infection, that's the initial COVID infection. Those symptoms might change a little bit in the aftermath of COVID. So, you may not experience as much brain fog. It might be more fatigue and bone aches and cough that you may experience during your initial COVID infection. And then you start getting either progressive or consistent brain fog starting after you've recovered from that initial COVID infection, and certain symptoms that just may be persisting onward and not really getting that much better. And the huge range of symptoms from mild to severe, there's still data being collected, but the estimated amount of people that experience persistent COVID symptoms after the initial COVID is like 5 to 30% of people. So it's very frustrating chronic disease right now that we're still don't know enough about, and we're kind of learning as we go. But there are still certain things we have learned about it and that specialists have learned to try to differentiate between what might be long COVID and these like arbitrary symptoms that can come along with long COVID versus something that may have been lingering before, that was developing before COVID developed. That's always a tricky thing, but it's an important thing to be aware of so that you can get evaluated and really differentiate what is something that is long COVID versus not. One of the most common I've really seen that people complain about is brain fog and headaches, and then muscle pain, dizziness, tremor, palpitations, fatigue. It's typically not all of these symptoms. It can be like one or two that people often experience, but there's a wide range of symptoms that we're seeing can really be related from COVID's impacts on the body chronically. One thing to note, long COVID, it's not transmittable. It's not something that will be passed on to offspring or like by cough or respiratory, the way that acute COVID is. Approximately 1 in 5 adults may have symptoms that are concerning for long COVID after previously having COVID-19. Musculoskeletal conditions is something I've also seen a lot. Muscular pain, joint pain, tremor and palpitations, not as much that I've seen personally, but it's been reported people that have experienced those symptoms. Kidney failure and blood clots and vascular issues are also some things that can happen with long COVID. And these are things to be aware. COVID hasn't universally been linked to causing kidney failure. Oftentimes, a lot of these conditions have been worsened by COVID, but are sometimes mixed in with some of the comorbid conditions that put you at higher risk for kidney failure or for blood clots and vascular issues such as diabetes and heart disease. So who is at risk? Both adults and children can experience long COVID. Definitely more common in adults from what we're seeing. A younger group of people between the ages of 35 to 49 that we're seeing have the highest rates, but we see it across the board amongst any age. You're at higher risk of having persistent COVID symptoms if you experienced a severe COVID infection in the first place, and especially if you experience multisystem inflammatory syndrome. So people who were critically ill or hospitalized are at higher risk, but you could have had a very mild COVID illness acutely and still develop long COVID. So it's not just if you were hospitalized, and it's not necessarily just if you have comorbidity such as diabetes, asthma, obesity, although this does put you at higher risk for experiencing long COVID symptoms. And lack of vaccination for COVID, we know, is a huge risk factor. A lot of people who have developed long COVID did not get vaccinated. And this is one reason it's smart that we are always emphasizing vaccinations, because it's really to prevent you from getting COVID in the first place. But even if you get COVID, it prevents not only hospitalizations, but your risk of long COVID. It really can help quicker recovery from COVID and help your body also recover and not have a persistent immune long COVID problems. And then we actually are seeing that women, they have a higher rate of long COVID than men. And then elderly people are also just at higher risk. And we're also seeing that the Latinx demographic is at higher risk and developing symptoms. We don't know what causes it. It's still unclear. Some of the ideas or theories is that there may be like remaining parts of the virus that are lingering in the body. The virus has become latent and deactivated and is not actually active anymore, but it does get reactivated in some way. Similar how some other viruses work, like tuberculosis, sometimes they can enter a latent stage where they're kind of like asleep, and then something triggers it to get reactivated. Another theory is autoimmune response. You get COVID initially, and then the virus completely gets removed, but it triggers some sort of other pathways of your immune system to act like how lupus or fibromyalgia kind of acts and cause symptoms in this way that your immune system's a little out of balance, that it's causing this pain or this brain fog or certain things in your body, despite the virus being completely removed. Then another theory is organ damage. This theory is that the virus may be eventually removed, but during that acute time, it caused some sort of physical damage to certain parts of your body that will cause persistent symptoms even after the virus is removed. And how is it diagnosed? So we don't know a single test. It is really based on the history of knowing whether you had COVID-19. Even if you tested negative for COVID-19, these are the arbitrary things of sometimes the testing isn't always 100%. So really trying to be aware of, even if you have a vague cold for a little bit, wasn't sure if it was COVID-19 or not, it didn't feel as severe as COVID, it may still have been COVID, and that may be something that's causing your symptoms. And then doing assessments and imaging and testing on specific symptoms. And really a huge thing with long COVID and diagnosing it is really ruling out a lot of other things that could be explaining your symptoms. And sometimes doctors will want to do that. It's really important to be ruling out other things because there's so many symptoms, and because other things are sometimes easier to treat and it's easier to target if it's something that's not long COVID, because unfortunately long COVID doesn't really have a full cure or treatment just yet. We still have ways that we can address it, but doctors want to know that we're getting as full of a picture that we possibly can get to understand what's happening in your body, to see if there's other things that we can target and rehabilitate or treat if there's treatment for it. Unfortunately, although long COVID doesn't have a specific cure, it does have ways to treat it and can really improve your symptoms. And for some people, you can make a full recovery from those symptoms just from like physical therapy. And counseling, I talk about this a lot with patients because I think it's overseen in terms of how much counseling can really impact your physical health. Even though counseling feels like it's just talk therapy and we're just talking things out, your brain, your whole body are having physiological reactions to having therapeutic counseling. And therapeutic counseling isn't just like one size fits all. It's not just like, how do you feel about this? It's very targeted, professional ways to address certain symptoms, certain things you're experiencing. This goes across the board for counseling for everything. Your body does really have physiological reactions to reaching different epiphanies around your symptoms, around your pain, around what you're experiencing. So just remembering that these impact your nerves directly. And physical therapy, moving our body, is important. This also trains your muscles and trains your body. And it's very targeted and specific to what you're experiencing to really fortify that your body and the areas around the organs that are problems, and strengthening what maybe can be strengthened and areas in your body that maybe have its limitations. Your body can really adapt, but it really requires some of that disciplinary physical therapy. I always say with physical therapy, people have different experiences with different types of therapists. So if you're feeling like you're hitting a wall with one that's like not improving your symptoms or maybe not listening to you when you want, your relationship with them really matters. So trying someone different is always an option. Making sure you're also advocating for yourself and speaking about what is bothering you, even if it's in your chart. They might see that, but they may not necessarily fully internalize and hear and cater things to what you're experiencing. So always advocating for yourself in these situations. And for other symptoms, there's memory exercises, olfactory training, there's rehabilitation specific to your pulmonary, cardiac, and neurologic health. And then there's medications that may alleviate the symptoms. But medication, in terms of long COVID specifically, they're not necessarily treatments. It is important to minimize your pain and minimize what you're experiencing. So I would still suggest taking medication, but then along with that medication should always come along with other ways that you're fortifying your body, strengthening your body, like in therapy and doing these memory exercises and doing rehabilitation that your doctor recommends for you. So a huge thing with long COVID is the prevention, staying up to date with the COVID-19 vaccines, practicing good hygiene, the hand washing, masks, and sanitizer. We should always be wearing masks in terms of the broader risks. Very important. Increased lack of vaccinations amongst a lot of people in our current administration. I think it's really going to become important for all of us who have a little bit more capacity and awareness of public health and respect of public health to really keep a hand sanitizer on us and always be masking as much as we can when we're amongst other people. We talked about air purifiers before, if you're able to, and then other precautions if you have a viral cold, just making sure you're resting and taking symptomatic relief. We've talked about these free clinics before, and then I do want to plug Dr. Carnevale's clinic, which is the one on the right, the Center for Post-COVID Care. I know that they accept Medicaid patients, so reaching out with that number, and this is also on 102nd Street. It's a little more accessible in East Harlem. I think brain fog is such a common one, and that's a very frustrating one because there's not direct treatment for congestion. We can find alleviation from doing like steam inhales, sometimes nasal sprays, like certain things might help alleviate it a bit. Brain fog, we can't really drink tea for it. That really helps. But that's also why going to that clinic is really important, because getting referrals for like memory rehabilitation and doing specifically rehab related to brain fog and exercises that are related to improving your brain fog, those can really help. And people have had really good reactions to doing that consistently. There's many studies that have shown that just simply talking about your pain can help your pain and help you feel better. And that is because there's a physiological response to actually talking about it and finding like the root of where your pain is in your body, and having that mindfulness is something that's really impactful. Jigsaw, Sudoku, crosswords, those are actually really helpful. There's some similar exercise that they often do in memory rehab, because a lot of it is just like reminding your brain how to rewire. And whenever you think of something, you're physically shooting a nerve. When you're doing those exercises, doing puzzles and things, those are actually revamping your brain and reminding it how to move. So that can really help with brain fog.
Is it possible that long COVID can be permanent?
We don't 100% know because it has only been 5 years, and that's the only amount of data we have. And we unfortunately can't predict the future. But what we are seeing is that some people do have these persistent symptoms. I do believe that the majority of people who have done some of these therapies and have actually consistent with trying to address their symptoms, they do experience some sort of alleviation. There are people that haven't necessarily seen full resolution of their symptoms. So in that sense, we fear that some of these symptoms can be permanent, which is also like finding ways that we can like live with it and alleviate it and still live a good quality of life despite some of the persistent symptoms for some people. And the hope is that trying to prevent things, trying to address things early on as you see things, like if you see a doctor before those 3 months after you've experienced COVID, they may be like, it'll probably go away. Within 3 to 6 months, if things are still really persistent, you want to start being like, okay, I'm really concerned this is long COVID. Can I at least do some sort of therapy or something to help address this? Some sort of physical rehab or something to address this. So trying to do those as early as possible, and when you're noticing these symptoms be persistent.
That massage or acupressure has been helpful with brain fog, or that can be helpful for some people.
That's a huge thing. Western medicine is still kind of learning its relationship with Eastern medicine. We've noticed there's been a huge thing in the last 5 years of realizing that acupuncture and massages are actually positively impactful for people with chronic issues. So I'm not surprised by that for brain fog. And then also for a lot of chronic pain that people experience or chronic symptoms, it can be really helpful.
And then one last thing, this is more about vaccination than it is about long COVID. As a way to remind people, does it matter what brand I get?
The original doses where they wanted you to get your booster in the same, but they found that they're very similar. So people are having the similar immune responses to both vaccines.
Get what's available.
It's more important that you're getting something earlier rather than later anyways, and not waiting around for a Moderna or Pfizer specific one.